The days are getting darker, the weather is getting worse, and you don't feel any better either. Do you feel slowed down or unmotivated to wake up during the dark days or late fall and winter? Quite possibly you just feel down in the dumps. But you might also have seasonal depression or seasonal affective disorder, and it's different from a normal depression. It is a type of depression that's related to changes in seasons. So today we are talking about winter depression. In the spring and summer, people function normally and feel just fine, while in the fall and winter they feel depressed, irritable, tired, while sleeping a lot, and they often gain weight. Less often, seasonal depression causes depression in the spring or early summer and resolves during the fall or winter month. Seasonal affective disorder is different from winter blues, which some of us may experience. Winter blues are accompanied with feeling sad from shortening days, climbing into bed earlier, and not wanting to wake up on dark mornings. You may also feel less energetic, creative, and productive. But the changes in your mood are more subtle than with seasonal depression and do not significantly alter a day-to-day life. These are common symptoms of seasonal affective disorder. The severity of symptoms vary from one person to another. To be clinically diagnosed with this disorder, you need to have experienced these clinical symptoms for 2 or more consecutive years. Young people and women are at highest risk for the disorder, but it can affect anyone. Men who have seasonal affective disorder may suffer more severe symptoms. The risk for the disorder decreases as you get older. People with a family history of the disorder or those who live in northern latitudes are at higher risk. Research shows that the further people live from the equator, the more often winter depression occurs. Seasonal depression is most common in people who live at least 30 degrees latitude north of south. In Florida, about 1.4% of the population suffers from the winter dip. In Alaska, 9.2%, and in Lapland as much as 30%. A Canadian study in a psychiatric hospital showed that the hospitalization time of depressed patients in the north wing of the hospital was on average 15% longer than that of the patients with the same complaints in the south wing. The exact causes of seasonal affective disorder are unclear. There is some evidence pointing to a disruption of a circadian rhythm. Circadian rhythm is the body's internal clock, or in other words, the natural cycle of sleeping and wakening. The disruption of the body's natural clock is a result of the reduction of daylight hours in winter, and it can trigger depression. Sunlight also plays a role in the brain's production of melatonin and serotonin. Melatonin helps us sleep, and its production increases in the dark. Daylight triggers the brain to stop melatonin production, so we feel awake and alert. When the days become shorter and the nights longer, our body may produce too much melatonin, and at the same time lower production of feel-good hormone serotonin, a neurotransmitter that helps to regulate mood. Some people are more sensitive to daylight shortage, so inherent vulnerability plays a role too, as well as an increased level of stress in a person's life and other contributing factors. Light therapy is currently the treatment for winter depression. A light cure of 5 to 10 sessions with a special light source can be enough to get rid of your somber feelings. Next week I will be talking about treatment of seasonal depression. I will explain how to choose the right light lamp and will provide you with self-help tips. So stay tuned and don't forget to like, subscribe, and to turn on the notification bell. Thank you for sticking with me. See you soon.